If you've ever consulted with me, you know I'm big on omega-3 fatty acid supplementation. It specifically has a role to play in my kids in the practice that have ADHD and autism spectrum disorder. The reason being, because many of them are deficient in omega-3s. In fact, their mothers may have been during pregnancy. And so we need to be aware that we no longer live on the coast. We're not eating as much fish as our ancestors used to. And so there's been a dramatic shift in the makeup of our brain from the perspective of healthy essential fatty acids, of which the omega-3s are paramount. So what does that mean? It means that we used to eat omega-6 to omega-3 closer to a 1-to-1 ratio. Now the omega-6 to omega-3 ratio in a standard American, Canadian, North American, Western diet is more like 10 or 15 to 1. So you may think the best way to shift that is to go out and eat a bunch of fish. And I don't, on principle, disagree with that strategy, except that aquatic wildlife is very contaminated with plastics, microplastics, and the neurotoxin mercury. Now, granted, some species of fish are better than others, and you should study that because we want to stay in the least mercury category when it comes to fish. But I've noticed there's no category that says no mercury. So the way around that, for most patients throughout the lifespan, but also for kids that have a diagnosis that relates to a neurodevelopmental disorder, where again, omega-3 deficiency is more common, is to strategize by using omega-3 supplementation. So fish oil supplementation specifically. A good brand, properly distilled, not contaminated. Usually these are derived from salmon or similar types of fish. And getting the correct dose with the help of your health provider.